as a citizen of Wyoming, as any of us would, if you see someone about to step in front of a car, you involuntarily grab them and keep them from getting run over. And my concern as a citizen who wants to see better health care access, and for the state of Wyoming to succeed, I feel like I need to grab the arm of the legislature and say, you're about to step in front of a car. Front lines of healthcare literally 6 days a week. I think I might be able to contribute something today to show you that there are other ways, and that Medicaid expansion is probably not one of them, at least not successfully. And the other worry that a lot of the doctors in my community have is if we expand Medicaid, we're going to break the core Medicaid for those people who currently use it and desperately need it. $30 million into the system here, realize that knowing that Medicaid on average across the country only pays 86 cents on the cost dollar, that means that you can expect that the people who provide care are going to lose the inverse of that. They're going to lose about $20 million because they're going to be providing care for these people, but they're going to be losing 14 cents on the cost dollar for every person they take care of. And I can give an example. I brought this up as a prop, had to borrow it from a local doctor. That's X-ray dye that we use when we do injections or procedures for patients. It makes doing the procedure safer. We know where we're putting the drug in the body. That cost me $9 a milliliter. Medicare pays me 35 cents a milliliter. Medicaid pays me 0 cents. Now, I still take the Medicaid patient into my office and I still take care of them as I would anyone else. But I lose money every time I take care of them, but I won't turn them away because I think I'm a good human being and I'm also a patriot. But at some point in time, we're going to go from being able to be good human beings and patriots to not being able to keep the doors open to take care of these very nice people that we want to take care of. All doctors in Wyoming want to improve access and take care of our fellow Wyoming citizens, and the existing Medicaid program is critically important to serve those people in true need. But Medicaid expansion in other states has decreased access by increasing wait times for Medicaid recipients in the existing programs in these expansion states. And by expanding Medicaid will necessarily shrink resources for these people in critical need, most of whom have no other options for health care. Here in Gillette, there's several of us who've been practicing for over 30 years, and we get up in the morning and go to work because we love our jobs, not because we need the job anymore, and it's not about the income. And we still see Medicaid patients. But if we expand the number of Medicaid patients, we literally will not be able to keep our doors open.
Medicaid simply doesn't pay enough to cover the cost of the care for the clinics or hospitals. And evidence of this is in the past year, we've broken a new record for rural hospital closures where 20 hospitals have closed in the US. Most of them were in expansion states. Medicaid accelerates the decrease of fiscal health of the hospitals. And in the first full year of expansion in Montana, hospital profit margins fell 40%. Why? Because there were an increased number of Medicaid patients, and they basically just ripped their profit margin down even further. Hospitals don't typically have a very good profit margin to begin with, and they're also vulnerable because they can't turn anyone away. Every day in Wyoming in our clinics, we see Medicaid patients from other states who fled California, Washington, Oregon, and even New York because they have Medicaid coverage in their state, but their healthcare infrastructure has broken under the weight of the increased volume of patients whose program doesn't pay enough to cover the cost of care. The current models for Wyoming expansion don't account for flight from these other states where people in these other states are just going to move to Wyoming because the cost of living is lower as well. And while the anecdotes from the proponent witnesses today are heart-wrenching, the statistics are damning. In other industry sectors, you as legislators ask ranchers, miners, bankers, and energy executives for their expert advice. And I'm advising you as a physician who's been practicing for 30 years. 5 years from now, you will not be happy you expanded Medicaid. I would strongly advise you, in my oath and my duty as a citizen of Wyoming, not to pursue this policy because I don't believe it'll be good for the long-term health of the state. The other reason is that most healthcare is so expensive is because since 1987, the federal government has been shoplifting healthcare by paying less than the cost of the healthcare, and so it's been dumped on the private sector. Expanding Medicaid just tips this over even worse, where the private sector will be stuck with more of the bill. If you don't think that Medicaid can be manipulated, realize this: in Wyoming, with unemployment rates from 5 to 7%, 38 to 40% of Wyoming babies are born on Medicaid. I'm sorry, but some of those people are manipulating the system for their own benefit.